Recently, the U.S. Preventive Services Task Force revised recommendations for breast cancer screening, causing quite a stir in the medical community. In our continuing series focusing on women's health issues, Lorene Cachola goes straight to the experts for a closer look at this controversial subject.
The recommendations in this new report say regular breast cancer screening should begin at age 50, not age 40. Women aged 50 to 74 should have regular screening every 2 years, not every year. And breast self-exams should not be encouraged by doctors. As you would expect, this informational bombshell from the United States Preventive Services Task Force, or USPSTF, is causing some concern in the medical community.
Well, I think you have to be cautious because the incidence of breast cancer does begin to increase starting at age 40. And there are many organizations like the American Cancer Society that continue to recommend that women age 40 to 50 continue with annual screening mammography.
In fact, officials at the American Cancer Society are quite vocal on the matter, stating the new guidelines imply that screening 1,904 women ages 40 to 49 in order to save one life is not worthwhile. What's surprising to many is the fact that these guidelines are a reversal of a report released by the USPSTF just 7 years earlier, where annual mammograms for women in their 40s were recommended. Since releasing the information, the USPSTF has admitted that the timing of the report was poor, coming amidst a heated debate on healthcare reform. But officials with the organization are standing by their statistics. Numbers, they say, claim that annual mammograms for women in their 40s can lead to false positives, undue stress and anxiety, and unnecessary tests and treatments. While those are important factors to consider, some in the medical community say there's a key element that's not included in that list.
We know that women who are younger in age, in the younger age groups, have cancers that actually grow faster. So I think it's even more important to look at young women with annual studies than it is with older women.
Dr. Lynn Gayden notes that the new guidelines did not take into account the benefits of cutting-edge digital mammography, which some studies show can detect more cancers than traditional analog mammography. It's also important to note that the new guidelines are not meant for those at high risk of breast cancer, which includes having a strong genetic or family history of the disease. Those in a high-risk category require aggressive screening, but even that aspect can be misleading to some.
We have to also remember that of women who get breast cancer, only about 15 to 20% have a strong family history of breast cancer. So not having a family history of breast cancer does not mean that you're immune to the disease.
Regardless of which side you're on in the debate, there's one thing on which both the USPSTF and the medical community agree. Each individual circumstance is different, so an open dialogue with your physician is a must. That open line of communication was critical for 42-year-old Lisa Callahan. Her mammogram last year revealed stage 2 breast cancer.
The fact that they found it when they did and the stage that they did gave me a greater chance of survival. At this point, I am completely cancer-free. Everything that I did after the surgery is considered preventative to make sure that it doesn't come back.
Lisa's journey of survival is well documented through her favorite hobby, scrapbooking.
I scrapbook everything, good and bad. And through all my treatments, my chemo treatments, my radiation treatments, having hair, not having hair, all of it.
And if Lisa has anything to say about it, the story ultimately told in this scrapbook will be one of hope and happiness.
It makes you appreciate everything so much more. The littlest things that you take for granted every day are a big deal when you're going through something like this. And even though I've been through a lot, I am very grateful.
For Smart Medicine, I'm Lorene Cachola.